Hello everyone, and welcome to our webinar today for learning about state health insurance exchanges for eastern states. Today we have Joel Ario, who's the director of the Center for Consumer Information and Insurance Oversight, and he is heading up this establishment of state health insurance exchanges across the country. Joel Ario left his job as Pennsylvania's insurance commissioner at the end of August, and since then he has been working hard to make sure that states are involved in this process of the Affordable Care Act implementation. He has experience with states not only in Pennsylvania, but also serving as the insurance regulator in Oregon. He is extremely knowledgeable in what's going on in your states, and we encourage you to ask questions of him after his brief presentation. And throughout the presentation, we will take questions for Joel and also for his staff. We're really appreciative of Health and Human Services for working with us and hosting these webinars, and we look forward to your questions and continue working with you. Joel?
Thanks for that kind introduction. Just to clarify, you gave me a promotion there. I'm actually the director of the Office of Insurance Exchanges, which is part of the new office implementing the law. Steve Larson is the director of CSGovts as a whole. But I do have a beat on the insurance exchanges, and very happy to have that role because I do come out of state regulation, and I do know that health markets work best, they're regulated best when the states are the principal regulators of the marketplace, and that's exactly what the Affordable Care Act envisions, is that states have the first option on standing up a state-based exchange. We hope that happens in all 50 states. It probably won't in my NEIC days. 50 states never got completely together on any single issue, but we certainly hope it's very close to all 50 states because, again, it works better, I think, when the states are in charge. If not, the law does call for us to set up a federal fallback exchange in any state that doesn't do its own. So what are the steps that states have to take? I'm going to lay out a couple of the basic steps and give you a little bit of background on where we are in the process of working with the states on this, and then throw it open to questions. And I can be around for about the first half hour here, and then Barb Menard, who runs our state assistance program, will pick up with some of the more detailed questions with you for the second half hour. So the two basic points I want to leave you with for today, thinking about this in your state this year, is one, it would be very advantageous for you to actually put in law this year the basic authority to establish an exchange and to carry out all the different responsibilities you have to stand that exchange up between now and 2014. There is a pretty straightforward model for doing that the NEIC came up with. They've been for more than 100 years now developing model laws for the states, and they have a very good model law that essentially takes the provisions of the national law, the Affordable Care Act, and translates them into state operational language so that the state has the authority under the Affordable Care Act to do an exchange. You can pretty much just take that off the shelf and use it, adapt it to your state. You probably all have staff people who've done that with an NEIC model at one time or another. It does obviously take some adaptation, but typically not a lot. The one issue that you'd have to do on top of the NEIC model would be a governance structure. The NEIC model simply points out that the law allows three different choices basically to states. They can have the exchange governed by a state agency. If you do that, it's pretty straightforward because there aren't kind of accountability and issues that come with that. You don't have to pick a board or anything because you've got a natural accountability structure through the state agency, through state law. But the states that I've talked to have found that model generally is a little more restrictive in terms of the ability to contract in the way you want to contract, and maybe some other kinds of issues as well. So then people look at the other end of the continuum. You can set up a nonprofit outside the government. It does have to be a nonprofit, and then you have to create the governance structure and all of those issues. Most of the states that have looked at that have said, well, that's probably a little too far removed, a little less accountable than we want to be. So most states have come to this middle position, which is set up some kind of quasi-governmental entity with its own governing board. And most states have models for this. A teaching hospital may be a model for this in a state, but some kind of quasi-governmental authority with its own board. So then you do have to decide who the board is and how they're going to be appointed. A lot of states say governor appoints some, legislature appoints some, that kind of thing. You'd have to deal with conflict of interest issues and so forth. But if you can basically create a governance structure and then use something like the NAIC model to put the basic responsibilities, the core authorities into law, that's really all you have to do this year to get your exchange moving forward. Once you do that, you'll probably end up in having some discussion about, well, there's a million choices under the law about, does the market go to 50 or does the market go to 100 for small employers? How much do we want to standardize benefit plans, et cetera, et cetera? Usually a good answer to those questions is that we don't have to decide that right now. We can, this year, create the basic authority, the governance structure, and then we can let these experts we've just now put on the governing board, let them study those kinds of second-level issues. And if the legislature wants to have a hand in that in the future, the board can report back to the legislature, and the legislature can decide next year about those kinds of issues. They are not pressing issues to have to be decided this year. So that's just an approach that you could use to getting your exchange stood up. People then say, well, what about if we can't get it done this year? The way we've looked at the timeline here, you're kind of putting yourself behind the 8 ball if you don't do it this year, but we can see a way that you could still stand up your exchange if you did this early in 2012. But it's far better, again, to get something going this year, get that board at least thinking about these issues, these implementation issues. So that's the primary thing to take away in terms of a step to take this year. The second point that I want to make off the top is people will say, well, we're in big budget crunch. I think that's true of almost every state. There's just a couple of states that are not in a serious budget crunch this year. The good news about the exchanges are that the federal government is on the hook for establishing the exchange, whether it's done by the state or whether it's done by the federal government. The law says that the startup costs of the exchanges are to be borne by the federal government. The standard in the law is that we will give states all necessary expenses to standing up an exchange, which means an exchange that meets the Secretary's benchmarks, that makes progress towards the Secretary's benchmarks. I'll come back and talk about what that means in a minute. But basically, as long as you're on track to develop an exchange that's going to be compliant with the federal law, all necessary expenses will be paid by the federal government through 2015. The exchange does have to be self-funding by 2015. That's after 1 year of operations. It has to have a self-funding mechanism. So that is an issue you have to deal with eventually in legislation as well. So those are the two core points. Pretty easy to get it done this year, and the federal government pays the cost of what the work that's being done between now and 2015. So let me just take a couple minutes to say where we are in process and then throw it open to questions. We started back in August with a planning grant process where we announced that all 50 states plus the District of Columbia were entitled to up to $1 million in planning money for an exchange. Very gratified by the response. 48 states plus the District of Columbia applied for those grants, typically right at the million number or very close to the million number, and all states did qualify. All states were awarded those grants in September of this year. So despite a lot of political noise around the act and the courts and all of that, 48 of the 50 states plus the District of Columbia have planning grants that they are in various stages of moving forward on in their states. And 49th state, Minnesota, is come in now and applied. They had to change a governor in the last election, and the new governor, one of his first announcements was, I want to join the other 48 states. So the only state that is not getting a planning grant from us and moving forward in some form or fashion is Alaska. They did announce last week that they're not going to do it at the state level, and so that becomes an issue that we'll have to address on a go-forward basis. It illustrates some of the complexity of the exchanges. It's the largest geographical state and one of the smallest population states. That's a scenario that's, whether Alaska does it or the federal government, it's a more challenging scenario for an exchange. But we will figure out some way. Maybe they'll be regionally with Washington or whatever. We'll figure out something for Alaska. So that's kind of where we start. The next step that we've done is in January of this year, we announced establishment grants, which is moving the process from planning to implementation. And again, in mind that states have a lot of flexibility under this law, these secondary grants, these establishment grants, have a lot of flexibility for the states. For the states that are really out ahead and already have their plan to go forward to 2015 with a budget, and they've got their law passed, they have their governance structure, they have a robust consumer assistance program, which is also a critical part of establishing the exchange. If they have all of those things, states can get full funding for 4 years, starting with the first applications in March of this year. First applications for establishment are due the end of March, so about a month from now. Most states won't be there to start. Most states will be in the other type of funding for establishment, and that's one-year grants, and those can be as ambitious as the state chooses. There are 11 different categories under our grant process there for developing an exchange, everything from stakeholder consultation to IT development to integration of the insurance and Medicaid programs within the state around the exchange. States can pick off 1 or 2 or all 11 of those areas and propose what they're going to do, and potentially grants could be as small as a couple $100,000, under $1 million, or a state that was taking a very ambitious approach to that might have, literally tens of millions of dollars in terms of a grant application. Just last week, we awarded 6 states plus a consortium in the New England another type of award. This is sort of separate and apart from these establishment grants for IT intervention to be kind of the leaders, the early innovators on IT, and those grants ranged from $6 million in Maryland to $55 million in Oklahoma. So you get a sense that that some of these things can amount to substantial grants for the states, depending on how ambitious they are. By next year, by 2012, states that start out with that one-year funding do have to be in the multi-year track by middle of next year. So that's kind of the drop-dead date. Middle of next year, you have to have your law in place, and you have to have your governance structure and be moving forward. And that's because only 6 months after that, the Secretary has to give green light, red light to every state on whether they're going to have their own exchange or whether there will be a federal fallback exchange in that state. So there's a window here, and we're hoping all the states use the window here and stand up their exchanges. But at some point, that window, and it's 2 years from now, that window does close. And so that's why we're very happy to be here today, giving as much information as we can out. And with that, I'll stop. I threw a lot of information out there quickly, and I'll be happy to take questions for a while here.
Thanks, Joel. Something that is an option is states collaborating to set up regional exchanges. How do you see this working, in what areas of the country do you see this working, and additionally, how does the federal planning grants and implementation grants work with the establishment of regional exchanges?
Okay. Regional exchanges are an option under the law. The general drift of this has been that a number of areas have expressed interest in this. Northern New England was one of the first. The 3, New Hampshire, Vermont, Maine, have similar regulatory systems, so they expressed an interest in this. The southern states, I call it the SEC exchange, there was talk of that kind of exchange. There's been talk of an exchange to kind of the spine of the West, where there are a lot of states, Montana, Wyoming, and down, that have large land masses and small populations. Utah maybe help to sort of lead something out west. Those kind of discussions have been going on. But where they've tended to go is that, gee, it's pretty hard to get to a full-fledged regional partnership. It's like a full compact because state sovereignty issues and just what we started with, the fact that the state markets are, different, and they're based in the geography and they're based in the health delivery systems and so forth. States end up not wanting to fully turn over their authority to each other in some kind of compact. So the discussions have tended to get more focused on, well, maybe we can't do a full-scale regional exchange, but we ought to be able to cooperate on some things. And you have in the New England states now with these early innovator IT grants last week, Massachusetts had like a $35 million grant or somewhere in that range to work with the other New England states around the IT aspects of this, of standing up an exchange. So that's one of the most obvious candidates for more cooperation. Utah has been pretty public about its desire to work with other states around some of the IT work that they've already done. And you can imagine different aspects of the exchanges on which people could cooperate. In terms of how that stuff gets funded, the statute envisions the funding coming through individual states. States are the sovereign entities under the law. So it would be like in the case of the IT grant, Massachusetts was the applicant. They had support from the other partners in their consortium. So regional exchange would work the same way. Somebody would kind of take the lead. Other states would apply for funding for their aspects of the regional work, but it would, although it's regional, still fundamentally work through state grants.
Great, thank you. In terms of setting up the exchanges, and one of the parts is making sure that state residents know about the exchange and know how to use it and everything like that. Can the funding from the planning grants be used for public education and outreach on the enrollment process?
Yes, generally. I may ask Barb to qualify this a bit, but in general, consumer support is an incredible and very important part of the overall process. The insurance is going to be sold primarily through the web pages under the exchange. That may not sound so good to people my age or older, but if you look at my kids, you know, the new next generation buys everything on the web. So that's going to be the primary way this is done. But there will be people, especially maybe people who aren't as computer savvy, who will want assistance. So the law does envision, assistance working through choices, assistance with ways to compare products. Also, outreach net, what's called navigator programs under the law envision, outreach to educate people about the law, to help get people to understand their options and to get enrolled in particular programs. So there's a lot of provision in the law that envisions that kind of outreach. I guess, Barb, I'm looking to you. Are there any limitations on, where a state says you want to spend a lot of money on some sort of, say, advertising campaign? Are there limitations on that sort of thing in the law somewhere?
There aren't, to my knowledge, and I think that it is an important part of the exchanges. I think it is something that states should be spending money on. And in addition to what Joel said about, we're going to be selling this through the web, the statute requires that each state actually have an in-person presence where people can come in and apply. It might not be a new office. It might be your existing Medicaid office. It might be through your Navigator program. But you also have to spend money on setting up an in-person presence for people to be able to apply that way as well.
Yeah, and then telephone is another option. They have to have a hotline and so forth. I don't know if there's anybody from Massachusetts, but one of the stories that is almost always told by whoever's telling the story of the Massachusetts exchange. And by the way, Massachusetts was a successful example in terms of the access issues here, was that they got the Boston Red Sox the year the Red Sox, won the World Series. Second time they won it in 2006. To do some of their advertising, and that kind of, they cite that as one of the things that helped expand public awareness.
So going back to the federal fallback, and if a state fails to set up an exchange sort of by the cutoff date that you were saying, maybe March next year, even though it's encouraged that the governance structure is set up this year, and the federal government has to step in and set up an exchange, can a state then set up an exchange in the future if they decide they don't like the federal exchange, or that there's a shift in leadership in a state, or any of those situations?
We're still looking at that. The better side of the argument so far from the lawyers is that we do have the flexibility to allow states to come in later. So given that flexibility, we're likely to try to provide some of that back to the states. The competing concern on that is that if the federal government does have to go through the work of standing up a federal fallback in a particular state, to then very quickly move that back to the state, and then potentially have it moving back and forth a couple times or something, you start to incur a lot of expense, and you start to think that may not be so good for the citizens of a state to have that much back and forth. So we're likely to, have some kind of process for states to come in later, but it won't necessarily be as flexible as whenever they feel like it. There might be longer lead times and that sort of thing. But again, the overall orientation of this law is to give the states flexibility, and that's one area that we'll try to find it if we can.
Joel, I know that we only have half an hour of your time. Are there any other points you want to make before we turn it over to Barb?
No, if there were, I could answer a couple more questions if people have them, but I've got maybe 5 more minutes here.
Great. We just had one come in, so okay. Thank you for the webinar. Can you describe the required conflict of interest protections for exchange governance?
This is an interesting question around how the issues of state flexibility work. When we started talking about this issue, there was probably pretty strong opinions that, we ought to have pretty strict conflict of interest rules here, no insurers on the board, no agents on the board, no providers on the board, nobody with a potential economic interest in the exchange should be on the board. That seemed like a fairly straightforward kind of starting point. There's a lot of federal money that's going to flow through subsidies to the state and so forth. So that was our starting point. Then you start to get out into the states and you have discussion, and some folks in California said, well, we wrote a very broad conflict of interest standard, and now we're having trouble finding people for the board that are qualified because so many people are conflicted out. And then a few other states said, yeah, we've had some of that same kind of issue. And so I've heard more talk lately about, well, maybe we could have people who have some connection to these industries just, on these boards, but not too many. And so there's the discussions around that have gone in a lot of different directions. And I think the lesson for us has been we're probably now more oriented. And again, none of this, by the way, has been put into regulation. I'm trying to give you real-time thinking about these things without telling you where we're going to come up, because frankly we don't know yet. I just came from a meeting where we were debating 4 or 5 of the different provisions, and they'll only be in the proposed rule, which will come out later this spring, and then there'll be opportunity for comment, and then the final rule comes out sometime later in the year, beginning of next year. So this stuff is still open, but where we'd probably land today would be something more like every state should have a conflict of interest standard, a clear policy that does deal with the issues in a way that's consistent with their laws, because every state already has some conflict of interest laws. So the moral of that story is it's likely to have more flexibility than a flat, like you can't have X or Y on the board. It's likely to have more of a, you have to have a policy and it has to be consistent with other policies within your state sort of answer.
Okay, thank you. Joel, our Eastern region contains also membership from the Virgin Islands as well as Puerto Rico. We have a question, just if you could expand on how exchanges might work in territories.
There's some divisions of labor within the office, and one of them is that the issues with the territories are very specific and very detailed, and I have not mastered them yet. So I'm hoping, Barb, that you can speak to that.
Is Jennifer Snow on the phone too?
Okay. The thing I can tell you is that the territories are treated differently, and they have a certain window here to apply, and they have a couple of choices around whether they want an expanded Medicaid program instead of an exchange that they have to make in the near term. But if I try to venture beyond that, I'm probably going to get it wrong. So I should leave
it. And that's about, Joel just hit it in broad strokes. I mean, territories have a different option under the Affordable Care Act to expand their Medicaid program if they would rather do that than have an exchange. We have set up a funding opportunity announcement for territories to apply for exchange implementation money, and we've done pre-application calls. What I'd like to do, because territories, they get into very specific policy questions, is if people have specific questions, they can follow up directly with me, and I'll make sure that we get the right people on the phone, because I don't want to give a broad stroke on a territory answer that then might not be correct for everybody.
Of course. Thank you.
And then I'm going to check out here and thank everybody for their participation, and again, pledge that we're we do a lot of traveling to the States. We're willing to come and kind of either through site visits or technical assistance on the phones or whatever, connect you with other states. Let me just tell one last story, because this is a lot of the wisdom on this doesn't lie with us here in D.C. A lot of wisdom on this lies with your fellow states out there. That when I first became an insurance regulator and went to NAIC meetings and sat at the table with the other commissioners and so forth back in 2000 in Oregon, I quickly realized that there was no way I could master all the issues, but I kind of picked up this thing pretty quickly of listening carefully at the table to my colleagues and then figuring out who knew the most about a particular issue and then going and consulting with them. That suddenly I could act like I knew, and in reality terms, I guess I did know a lot more about issues simply because I knew the 2 or 3 people who knew the most about it in the country. So there are multiple opportunities like that, and we try to connect you guys. But you know, some of it comes to us, but I would also be always kind of looking and figuring out what other states are kind of like your state and kind of seem to have the same kind of approach to these things, and you're likely to get a lot of wisdom out of talking to those states too. So thank you for your time, and I will you know, be around as much to help you as I can. Thanks.
Thank you, Joel. We appreciate it. Barb?
Yes, I'm still here.
Great. Do you have any follow-up on Joel, or should we continue with questions?
You can just continue with the questions.
Okay. Can you describe any tools or assistance available to states in developing exchanges?
Yeah, that's a great question. It's one of the things that we are really focusing on here at CSIO. So in addition to the funding opportunities that we put out that Joel has talked about and the guidance that we've put out that Joel mentioned earlier, we also have a technical assistance team and a team of project officers here in the office. So the project officers are all assigned a group of states, and they're working directly with the grantees in those states to make sure that all of the requirements of the grant are being fulfilled, but also to be a clearinghouse for questions that states might have. And then we've got our technical assistance team that is here to help with anything from taking a look at legislation to make sure that it comports with the Affordable Care Act to diving through some specific issues. We can connect you with issue area experts in risk adjustment if you need it, or anything that you're struggling with out in the states as you're trying to put up your exchange. We have people in the office that can help with that. So we've got technical assistance staff, we've got project officers, and then what we're also doing is we're doing a series of in-person meetings and webinars. So we have webinars like this one right here that we're doing on specific topics. We have one this afternoon on how to do an IT gap analysis. We're going to be doing one on how to do an exchange budget that people can get on, and those are helpful. We had an in-person meeting of all of our grantees in December. We're going to have another one in early May. So we're trying to set up opportunities for states to come together and not only get information from us, but to do peer-to-peer learning and to make sure that states know, if they have a particular question about an area, there's been another state that struggled with it that maybe has already figured it out, we can connect you with the people in that state. So through us, through our grantee program, and then NASHP is actually doing a really good job too. They've got a portal where they've got information that they're putting up, and they've got a listserv that is connecting a lot of people that are working on exchanges. So I would suggest looking at them too, but come into us, we'll connect you with the right people.
And going sort of, I don't know, the whole IT conversation, are there any plans for sort of using, once the health insurance exchange system is set up, using that infrastructure to enhance the health IT exchange effort?
I'm a little confused by the question. Once what is set up?
Once the state health insurance exchanges are set up, are there plans to use that network to broaden health information exchange efforts?
Well, we want to make sure that we're coordinating with the HIE efforts, and we are doing so. Right now, what we're really focused on is we're coordinating with Medicaid. So everything that we do is directly coordinated with Medicaid. The exchange system and the Medicaid system will be hand in glove. You're seeing all the guidance come out of Medicaid and exchanges together. The 90-10 match is coming out of Medicaid at the same time the exchange systems are being built. So we also know that we need to coordinate better with the HIE efforts. We will be doing that, and we're going to be encouraging people on the state level to do that. So if people have ideas specifically about things that we could be doing that would be helpful, please send them over to us, and we'll make sure that we're doing that coordination.
Excellent. For the plans on the exchange, so long as they meet the minimum benefit requirements set forth in the Act, are states able to prevent certain services from being covered on those exchange plans? And how flexible will the standards for the plan's coverage be from year to year?
So what you're talking about is essential health benefits. We are pre-regulatory on that, so there's not too much that I can say. But the way the Affordable Care Act is written is once the essential health benefits are defined through federal regulation, states will either, they will be offered in the exchanges, and if states go above that, states will have to pay for benefits that go above what is defined in the federal regulation of essential health benefits. I don't know yet whether that's going to be tweaked from year to year. We're still very early in the regulatory process on that. What I do know is we'll probably have out a notice of proposed rulemaking on that in the fall. And if states need flexibility on that from year to year, that's something that states should be saying in the comment for that NPRM that comes out in the fall.
Okay. And one last question right now. Some states have been interested in allowing insurance purchase across state lines, believing it may lower premium costs. Can states band together in exchanges to create larger risk pools and lower premiums?
You know, I don't know how we're going to come out on that yet. That's a good question. It's something that we're looking at, and I don't know how we're going to come out on that. And that's obviously complicated by the current state regulation of insurance. So I don't want to overspeak on that until we have more of a clear answer on that.
Of course. Well, I'm not showing any more questions, and we don't want to keep you from your other webinars that you have today, Barb, but we really appreciate your whole office's help and working with states and offering assistance and guidance and keeping the communication lines open, and we encourage anyone on the webinar to contact you if they have questions in their state as they work through setting up.
In that vein, Nell, I'm going to give people my email address. That's